Welcome to Emptying an Ostomy Pouch, a topic from the video series WEB WOC's Ostomy Procedures and Techniques, sponsored by an educational grant from Hollister Incorporated and lectured by Deborah Naich, APRN, FMP, CWOCNAP, CFCN. Of note, the attachment of connectors and detachment will vary depending upon the manufacturer of the night drainage system or pouch in use. As a nurse, you will need to be comfortable with this procedure and teach your patients how to empty the pouch. You will likely be performing or teaching the patient this procedure. When the patient is unable to empty the pouch independently, for example, during post-op recovery, or when an ostomy patient is admitted for another cause and unable to perform procedures. Preparing for patient discharge or self-care in your facility. An ostomy pouch is emptied when it is 1/3 to 1/2 full. If the patient has a fecal stoma, that includes gas. If the pouch overfills with gas, stool, or for the person with a urostomy, urine, leakage may result, or the wear time of the skin barrier seal may be shortened. Emptying when 1/3 to 1/2 full will also prevent a noticeable bulge under the patient's clothing. The patient may ask you how often the pouch will need to be emptied each day. Of course, this will vary from person to person and depend upon the type of stoma. But generally, a pouch will need to be emptied 2 to 6 times a day. Immediately after surgery, the fecal stoma will have increased gas, which requires more frequent emptying, but as stoma function stabilizes, 2 to 6 times a day is likely the range to identify. The urostomy patient will likely need to empty in the higher range of 5 to 6 times a day. The bottom of the drainable pouch either has a closure that rolls up and seals the bottom of the pouch, or it has a separate clamp. A urostomy pouch will have a spout or tap at the bottom. Only urostomy pouches have this feature unless the patient is wearing a high output pouch. Emptying the pouch is the same whether fecal or urostomy stoma. The established patient may have variations to this procedure, but the nurse will usually follow this procedure. When the patient is unable to get to the bathroom, the nurse will perform the following procedure at the bedside using a basin to collect output. The remainder of the procedure is the same. When the patient is learning the procedure, use the following instructions also. Whether the patient is using a drainable pouch for a fecal stoma or a urostomy pouch for a urinary stoma, it is best to have the patient who is ambulatory sit on the toilet to empty the pouch. Most people find that it is best to position the pouch between their legs over the toilet. If splatter is an anticipated problem, a small amount of toilet tissue may be placed into the toilet bowl before the pouch is emptied. When emptying the drainable pouch, the patient will open the closure device and empty the pouch into the toilet. If there is thicker stool in the pouch, the patient may need to pinch the sides gently as they empty. When the pouch is empty, the insides of the pouch outlet can be cleaned with a piece of toilet paper and discarded into the toilet. Some people prefer to clean the outlet with a pre-moistened towelette. The towelette is then disposed of rather than being flushed down the toilet. No rinsing of the pouch is necessary as it may actually limit the wear time of the pouch and skin barrier. When emptying the urostomy pouch, an optional valve cap may be in use. It is removed before emptying. The valve is opened and the flow of urine is directed into the toilet. When the pouch is empty, the valve will need to be closed. The optional cap may be replaced. At night, some people use a nighttime drainage bag so that getting up to empty the pouch is not necessary. The purpose of a nighttime drainage bag is to prevent the urostomy pouch from getting too full while the patient is sleeping. Patients who are light sleepers ambulatory, and able to comfortably get into the bathroom at night or call the nurse to assist may choose to simply get up during the night to empty the pouch. This pattern of getting up during the night is likely routine for the patient at home. If a nighttime drainage bag is used, remove the valve cap if one is in place and attach the urostomy drain tube adapter to the bottom of the pouch. Push the adapter onto the drain valve until it is secure. Next, insert the connector for the nighttime drainage bag securely into the adapter and open the drain valve. In the morning, when it's time to disconnect the nighttime drainage bag, you will first need to close the drain valve. When the valve is closed, hold the drain valve with one hand, then simply squeeze the sides of the adapter and pull it away from the drain valve. Finally, if you are using a valve cap, replace it now. A nighttime drainage bag can be reused but should be cleaned after each use. When the night drainage bag is empty, simply run a cleaning agent designed specifically for this purpose, like M9 Cleaner Decrystallizer, through the tubing and into the night drainage bag. Follow product instructions for proper use. Emptying an ostomy pouch is a basic skill for nurses and patients. Leakage and a shortened wear time of the pouching system can be avoided when emptying the ostomy pouch when 1/3 to 1/2 full. Prior to use, be sure to read the instructions for use for information regarding intended use, contraindications, warnings, precautions, and instructions.